Welcome to another Can Do MS webinar. My name is Krista Sipp, and I'm the Director of Programs here at Can Do MS. I will be your moderator this evening. Our topic for tonight is building a healthcare team you can trust, from diagnosis to daily life. And thank you all again for being here. We're excited to partner with the Texas MS Consortium to offer two special webinars this month. Tonight is the first one, and then next Tuesday is the second one. We're thankful for their partnership and the exciting projects that we're working on together. If you are here and you're not in Texas, if you don't live in Texas, don't worry. This information is relevant to everyone who's affected by MS. And I want to take a moment to thank our generous sponsors for supporting this special webinar series. Thank you to Kathleen C. Moore Foundation, thank you to Genentech, and thank you to Novartis for their support in making this program possible. And we have some other programming this month that I'd like to highlight. So as I mentioned, I specifically want to call out the next two webinars. So we have another special webinar next Tuesday, a week from tonight, and that is on hormonal health and MS. It's a guide for both men and women with MS. And that'll be, again, Tuesday, August 12th, a week from tonight. Then next week, we also have Addressing MS Discomfort from Numbness to Pain, another webinar. And there's some meetups and additional programs this month, so check out our programs calendar. We'd love to have you join us. And now I have the honor of introducing our two speakers this evening. Both of our speakers are from the great state of Texas, so thank you ladies both very much for being here. Dr. Catherine Rivas is a neurologist out of Lubbock, Texas. And then Maggie Rodriguez is a nurse practitioner out of McAllen, Texas. Maggie also lives with MS, so we're excited about the multiple perspectives that they'll bring to tonight's presentation. And as usual at Can Do MS, we're going to roll on a first name basis, so we'll be referring to Dr. Rivas as Catherine this evening. Thank you guys so much for being here. We really appreciate all the knowledge you're about to share with us. And now I am going to hand the presentation off to the two of you.
All right. Thank you, Krista. All right. So my name is Catherine, as Krista was saying. My specialty is in neurology. I'm a medical doctor. And my fellowship, I'm doing a fellowship in MS right now. MS is my passion. Let me tell you all that I'm very excited about being here. I'm excited that technology has brought us here to the point where we can do a webinar and we can bring information to all of you. Maggie and I are very excited about it. And the whole point of the webinar is to empower you, to give you knowledge, to share with you information that will be valuable for you all, to help you understand who needs to be a part of your team, the support that you need. It's not only a neurologist, even though it's a neurological condition with inflammation, with neurodegeneration. There's a lot of other doctors and fields that come into play with multiple sclerosis. We're going to talk a little bit about medications. It's an exciting time, definitely. Back in 1993, the first MS drug was introduced, and at that time, we only had one drug, which was beta-seron, and now at this point, we have 20 plus options. So it's a great time regarding the medications because we now have more options. We're going to be talking about how picking a medication is not about your doctor telling you this is a medication you're going to take. It's a shared decision. It's about what's going to work for you, what you feel comfortable with, what will make you stick to the medication, talking about side effects, what to expect with the medication so you're aware of it. How to advocate for yourself is another important thing we're going to be discussing about, and how to find trustworthy resources. We are living in a great era with a lot of technology, which is great, but at the same time has its disadvantages where people can be misinformed. If you don't log into the correct web page, for example, you might get information that is not correct. And that's why it's very important to always talk to your medical team. And we're going to be discussing with Maggie places that you can go into the web and look for information that's valuable and that's certain. So we have a polling question, and if you don't mind answering, what people you have in your team right now to help care for your MS, okay? So let's see what y'all have for us. I'm not seeing any answers here. Check. Okay, so I'm seeing some percentages here. So looks like 95% have a neurologist. That's great. Around 74% have a primary care provider. Around 50% have a physical therapist / occupational therapist, and we're going to be talking about how important this is. I feel like a lot of my patients benefit significantly from having a physical therapist. For cognition or see a neuropsychologist, speech pathology is approximately 10%. So that's on the lower side for cognition. And other specialties, urology, dietitian, around 34%. So looks like on the lower side, we have integrative medicine, urology, and cognition. So we're going to be talking about you knowing at what point maybe you should be asking either your PCP or your neurologist, maybe I should be referred to someone else, and advocating for yourself as well.
Okay, hi, my name is Maggie Rodriguez. I'm a nurse practitioner in McAllen, Texas. I have been a nurse for about 16 years. I have had MS for, I'm going on 18 years. When I first got diagnosed, of course, like Catherine was saying, there wasn't a lot of treatment options, which now there's 20 plus medications. So it is a good time if you are going to be diagnosed with MS to be diagnosed. The treatment options are great. Patients are becoming stable. So I think that, like she said, we are advancing, especially with this disease. I think it's really important from the ground up is having core members of the MS care team, not just, I know a lot of you guys answered, you do see multiple doctors, and they are all important. But it starts off with the neurologist. The neurologist usually is the one who is going to diagnose and give you options in disease modifying medications. They'll also continually monitor, and they'll be looking for relapses, and they'll be going over treatment plans. The nurse practitioner and the PA, they do similar jobs. In some offices, they will diagnose as well. But usually they do more of the follow-up visits in most of the office, and they let the neurologist kind of take the lead on diagnosing. But they also do symptom control and medication management. You'll also, part of the core members is ophthalmology, which is very important because a lot of patients with MS have optic neuritis and have vision issues, whether they got better, but they could be from the beginning they had them. And so it's really important to have follow-ups with ophthalmologists at least once a year, just to be watching out for your eye health, especially because sometimes with MS, we always, we worry about glaucoma, different things like that. So it's really good to go to the ophthalmologist. Also, some ophthalmologists will do vision rehabilitation. So that is another option as well, depending on your area you live. Also, pharmacists, very important part of the team. They optimize medication regimens. They look for safety, adherence support. They definitely look for adverse event management, making sure that we're all taking the medications and we're not having any side effects. Also, there's I really like this diagram because when I was talking to Catherine earlier, it's really important. Like if you look at the orange in the middle, that's kind of where it starts. It's the biggest participant and care partner is the patient and their family, and it branches out from there. Whether you go from having the primary care physician maybe seeing something, referring you to the neurologist, and then you kind of make your way throughout this. Everybody's journey is completely different, but they're all of these different areas are very important for like life coaching, dietitians, especially with health. There's so many diets out there that we just are unsure of, and what would actually benefit us, what maybe not benefit us. And like I went like back, the pharmacists, the mental health care, especially with mental health care, getting sometimes some offices will do neuropsychological evaluations, which are very important because the biggest thing in MS is we worry about our cognition. And so it's kind of good to get baselines, and then, we can go from there. Also rehab, which Catherine also mentioned, PT, OT, speech therapy, because you may be doing really good, but there's going to be moments where you may have more muscle weakness, or you may, have the heavy leg, or, different things, or drop foot. And we may need to seek out to see these professionals, which they do great with rehab services.
Okay, so talking a little bit about why do we need to treat MS, right? As we know, MS is an immune condition. What does that mean? So the immune system, to put it into simple words, consists of the system that basically protects your body from viruses, from bacteria, fights them. You have B lymphocytes, you have T lymphocytes, you have microglia, macrophages, to mention a few that play a role in MS. Okay, so basically, your own body, your B lymphocytes, your T lymphocytes are confused and are attacking your own body. That's why it's called autoimmune, right? So I like to tell my patients to imagine this. Neurons are the cells in your brain. Imagine your arms as the dendrites, which is where information comes from one neuron to the next. Imagine your trunk as the body of the neuron. And then imagine your legs are the axon, which is where information gets out of the neuron onto the next one, and so on and so on. And then your pants are the myelin, okay? And then you have dogs outside trying to rip on your pants and biting on them. So those are the B and the T lymphocytes fighting and eating your pants and eating away that myelin, okay? So that's like an easy way to understand. And that's why it's a demyelinating disease, okay? Your dogs, your B cells, your T cells attacking that myelin and damaging the transmission of information from one neuron on to the next. That's why a lot of people with MS, some of their first symptoms, cognition problems, you realize you're slower to respond to an audience. It takes you a little bit more of time. You're foggy, you're clouded. You can't come out with the right word. So those are some of the symptoms that MS patients could experience at the beginning. And then depending on the areas where these demyelinating plaques are located in the brain, you're going to get different symptoms, the weakness, the numbness, the tingling. So it's important to treat this disease because MS leads to disability, okay? And I don't mean just disability at the level of I'm weak, but disability with fatigue, for example, where you have other symptoms that keep you at night awake, urinary frequency, urinary urgency, the spasms, all of the symptoms that interrupt, for example, to give an example, your sleep, and then you're fatigued, and that creates disability, or the motor weakness, or the visual symptoms. So once lesions occur in the brain, once these dogs attack your myelin, once your B cells, T cells attack, and you have a lesion in your brain, there's no way to repair that myelin. We haven't reached that level yet in science. But as I was telling you, It's exciting times, and maybe in the future we're going to have a way to repair myelin, and that's something I can only hope for. As of the moment, we don't have, but that's why prevention is so important. So if I start a patient on disease modifying therapy, that doesn't mean that I'm gonna go back and delete the lesions that you already had in your brain. That doesn't happen. The lesions that you had are going to be there, are like a scar in your brain, but we can prevent other lesions, new lesions from forming, or the lesions that you already have from expanding, or having lesions that enhance or cause a flare. Okay, what's a flare? It's whenever you have symptoms for more than 24 hours that don't go away. I tell you, go to the hospital. It could be a flare. We get an MRI. We give you contrast, and that lesion is eating that contrast and lighting up on the MRI. So that's a flare. And at that moment, that means that possibly the disease modifying therapy you're on might not be working. Could it be time to switch to a different disease modifying therapy? So that's the importance of DMTs and the drugs that we're going to be discussing. What we want to do is prevent new lesions from happening and disability to worsen. And that's what that last sentence says. We are wanting to decrease progression, reduce the frequency, and reduce the severity of these relapses. Okay, so two big buckets with treating MS. We have the disease modifying therapies that what we're gonna do is prevent new lesions from forming, and then we have symptom management. What you all have heard, like these invisible symptoms, sometimes the fogginess, the urinary frequency that you're experiencing, or the spasms, or the fatigue, or the depression. So we do have the disease modifying therapies to prevent further disease progression, and then we have other medications to help address specific symptoms. When considering disease modifying therapies, a lot of things come into play. I like to group them depending on the modes of administration. We have orals, we have injectables, we have infusions, okay? And we're going to talk a little bit about some mechanisms of action, how you administer them, what are high efficacy or not, some of the side effects. Talking about disease treatment and management of the symptoms per se, just wanting to let you know on this slide that we do have medications tackling each of the symptoms, most of them, not all of them. But for example, cognition, we don't really have a medication to help with cognition. But if you are feeling foggy, if you're feeling like you're having difficulty with your words, something we can do as neurologists is send you to a neuropsychologist, get neuropsychological testing, getting lab work, making sure your thyroid, for example, is working well, your vitamin B12, making sure there are not other things that could be influencing your cognition and not just your MS. And then there's testing that can be done for cognition to see which areas particularly are affected. Regarding mobility, as I was saying, very important to have a physical therapist and occupational therapist really helps with mobility. As I said, once you have a plaque, that part of the brain is gone, but your brain relearns, okay, and then make different circuits. So physical therapy really helps you with that and strengthening. Bladder, bowel, the biggest thing with this would be a spastic bladder. We do have medications to help with that. We could do Botox, we could do oxybutynin, mirabegron. For fatigue, we also have stimulants. We have amantadine. For muscle pain, for neuropathic pain, this nerve pain, we can do gabapentin, we can do Lyrica, we can do duloxetine. So the point of this slide is to let you know to speak up to your neurologist, to speak up to your whole team, because if you're experiencing a symptom, there are things that we can slowly start doing before trying medications. But if at some point you do need medications, we do have options, and that is something very important for you to know.
Okay, hi. So going on with the best practice for MS care, the optimal MS care is a multidisciplinary team. We use integrated and patient-centered care for our multidisciplinary team. So we use integrated care models, which those are care units as like the MS comprehensive centers, or if you are part of a bigger organization or part of a university or wherever you go get your MS treatment, those are integrated care models where they're integrating everything for your care within their system. We want to have regular team meetings. I think it's very important, and it's okay to ask those questions when you're at your doctor. The biggest thing is always asking questions. You have to advocate for yourself. So ask them, are you having regular team meetings? How often do you meet? Do you talk with the other healthcare providers that are also treating me for overactive bladder or cognition, and how often? Because I think shared communication is really big. Earlier we were talking before this started about making sure before you're going to go somewhere else, or even go to, if you're at one facility, seeing the neurologist, and even though you might be a part of that same system, like maybe asking for your notes so that you can go home with the notes, and then you can take it with you to your next appointment, so then they don't have to try to request them. So then you already have it there, and you get your questions answered at your appointment, and that way you're not having to have delayed in your care. And so I do think that is a really big thing. Also, asking at your facility, do you guys have a patient portal? I know in our facility, like, I will ask my patients, make sure before you leave here today, especially if they are going to have to go to see other doctors in our system or just outside of our system, do you have patient portal access? Because if you do, then you can print your own notes at home, especially if if the organization where you're going to see your neurologist or your urologist or GI doctor or any other doctors you're seeing for your MS care, maybe they charge a fee. So it is always good to see if they have access for you to get, so that you don't have to always depend on like taking everything with you all the time, or asking for notes as well, especially with costs. You want to try to minimize the cost. Another area, like Catherine has said, is shared decision making. It is very important, especially with this disease, that we have shared decision making with everybody we work with, whether it's like for me, I'm the nurse practitioner, so with the neurologist, or if I have a patient that's having issues with bladder or bowel, it is important that I can, seek out to talk to the other healthcare provider, and also make sure that you're a part of that shared decision making. I understand, like, they're the doctors, they're the specialists, but at the end of the day, the most important person is the patient. And it's really important that you engage and really ask questions and make sure that you're part of the decision making process. Especially, I know where the region I live, it's not just one person that comes to the appointments. I mean, if you need to take family members, especially your support person, always bring your support system, because you go into your appointment, because this happens to me, where I go in, if I'm by myself, sometimes I can't remember some of the stuff that I wanted to talk about, and now you have your support person with you, and sometimes they'll bring up stuff that you completely forgot that you wanted to talk about. And so everybody sees things a little bit differently than you, so that's important for you and for your doctor. Also addressing access, and when I talk about that, it's like, strategies to overcome disparities. Strategies like cultural competency, training courses, especially with racial or ethnic disparities. educating, making sure that we're getting the patients the proper education with that. Making sure to that, let them know we can do telemedicine. I mean, not every facility is okay with their providers doing telemedicine, but ask them, is this an option for this facility? Because, with MS, you don't know how you're going to always feel. And if you're in areas too where the climate is really hot and, you're at 100 and some degrees, you don't always want to venture out to go to your appointments. You just have more fatigue. And it's okay to ask those questions because those are important, because with MS, we always need to look towards like what could, what maybe could happen. And so if this were to be my situation, what would I need in place? How could I get the help I need if I can't make it in? And I think that's really important. And those are questions that like ask from the beginning, because you don't want to get like where you're loving the place, loving your neurologist, and then if you have a situation now you can't see them for a while, and delayed treatment and delayed getting help just delays your ability to feel better. So I do think those are all really important areas of the patient-centered.
And another thing I would encourage, Maggie, as well, is writing down maybe the questions
Yes.
that the patients have. If you can bring, like, I have a lot of patients who carry with them notes describing or symptoms they've had or questions they have.
Right.
Because sometimes you get to your doctor's appointment and you forget what you were going to ask. So that could be something helpful.
Yes, and I agree, because I do, and I was telling Catherine earlier that I may during this this presentation, I do have MS, and I may forget my words, because that is a real thing. Yes. It is a true thing with MS, and so that can happen. So yes, writing things down, that is a great idea, because I mean, even if we don't have MS, I think that's really good practice.
Exactly.
Because all of us forget, like, what we get there and it's complete like silence. I'm like, oh, I'm fine. Yeah. And I just complained for the last week about like 4 things,
And you just step out of the office and then you're like,
yeah.
I forgot to ask this. And it's happened to me too when I go to my PCP. So writing it down even on the phone helps.
Yes. And now we have the technology, as that, before we actually had to write things down, but now we actually can, and even if you are having troubles with like numbness and tingling and you can't write things down, at least now you can, Siri will put it into your phone. So like she said, yes, putting it into your phone is a great idea as well. Going back to the shared decision making, because the process really brings everybody together. It's the clinician's expertise and experience, because it goes over options, research, risks, and benefits. Because your clinician may at that facility they may have research going on, and you may be a really good candidate for that, but you wouldn't know unless your physician's going to bring that up, because that's their expertise. So definitely that's when that shared decision making is really, really important, because they may say, you know what, you may be perfect for this clinical trial. And because like she said, like Catherine was saying, every day we're coming out with more and more things for MS. So studies and being part of clinical trials are really, really important. And also like the benefits of shared decision making, and those are one of the benefits, is being firsthand, getting to maybe be in a clinical trial where that medication, I mean, which is like what we were talking about earlier, like remyelination, we just don't know, right? And so it's going to affect everybody so much differently. And so there's so many trials going on right now that it is an exciting process. Actually, where I work, I am in charge. I mean, I'm one of the people that helps out with the scoring in a clinical trial. And for me, every time my patient leaves, I tell them thank you, because it is huge, because this is to help myself as well, not just for my patient, but it's to help all of us, that are living with this disease. So I do think it's really, really important. And also, and in that part of the shared decision making, is the patient's preferences. Like she was talking about too, like what type of medication would you like to take? Those kind of things. What is your daily life like? What are your goals, values, and beliefs? Because not everybody has the same goals. Not everybody has the same values. And you have patients that want to get better, like right there and then. And then you have the other patients that they're still in that denial phase. So like trying to, express how you're feeling is really important for the clinician to be able to treat you um, to the best of their ability. And then, together you can choose the best course of action and make a good selection together based on what you have expressed to the clinician of what you want. Your individual. Go ahead. Sorry.
Sorry. So talking a little bit about the individual needs, goals, and values. What we were saying, it's important to talk with your neurologist. Do you want to do something on the moderate efficacy, high efficacy range of disease modifying therapies? What side effects can you expect from the medication? If you're family planning, very, very important. If you're taking a disease modifying therapy and you're in your reproductive age, important to use contraceptive methods always, because it's not that the studies have demonstrated that it might cause something to the fetus, but we don't have enough information yet on all of the drugs. So it's a very uncertain area. So if you are planning on getting pregnant, my best recommendation would be to go ahead, talk to your physician about it, plan it ahead of time. And in that way, disease modifying therapy can be stopped, or you can be switched to a medication that's have been shown to be safer during pregnancy, such as Copaxone or Betaseron, which would be on the safest side. Also with breastfeeding, most of my patients who become pregnant, I usually just stop disease modifying therapy overall. And this is something that can be done because while you're pregnant, your immune system goes down. So less chances of having a relapse. But if it is a patient who frequently has relapses or the disease burden is a lot, what I mean by that is a lot of plaques on the MRI, then it might be worthy to continue some sort of disease modifying therapy. But again, planning is very important. Talking about how treatment fits into your life. Are you willing to take a pill daily or not? And being honest with your doctor about that, because sticking to a medication is going to be very important. Lifestyle modifications, trying to stay away from processed food, sausages, bacon, trying to go more with a Mediterranean diet, high in fishes, high in chicken, vegetables, fruits, all of those antioxidants, and a holistic approach, which is very important, right? What we mean by that is having a whole team, as we've been talking, with medications to treat symptoms specifically if needed.
Okay, some examples of the shared decision making when I did go over some of them earlier, but like Catherine was saying, making sure that you ask the question. That is like, I cannot express that enough. Making sure, like, write them down. And your time is very important. And don't ever if you feel rushed, then that may be not where you need to be, especially when you're making choices on this is something you might have to be taking like for a long period of time or every 6 months or whatever you choose, but it's still a big decision. And so I just want you to stress that, don't feel like, what, I'm, I'm holding him up or I'm holding her up, because this is your time. This is your time to ask us the questions that you need answered. Also, when we talk about lifestyle, with the, sometimes patients can't get time off from work to be able to go do an infusion. So in that case, then that's when you would maybe choose something else. Or you have patients that are like, you know what, I can barely take my birth control pills. Those are the kind of patients you're going to be like, okay, if I can't take my birth control pills regularly, I'm probably not going to be good with taking oral medication. because the biggest thing is staying compliant with whatever you choose to do. Um, and knowing what, and also making sure that, you know, knowing what type of mediation works for you. Examples are like medication is how is medication actually. So how is it administered? Like Catherine was saying, is it an injection? Is it infusion? Is it by mouth? And then what are the side effects? Because that is important. Because some patients, like she said, don't want to lose their hair. And other patients are like, you know what? I don't care if I lose my hair. I want to feel better. And this is going to be the best treatment plan for me because I don't like all these other things. And so, I mean, because if you really sit and think about it, we could probably find something wrong with every single choice you're going to make, especially because this is all new to you. So the anxiety is high and just, you just kind of feel overwhelmed. Also, sometimes having them give you the information. I mean, we do that at our office. We give them all the information, and then we give them a couple weeks to be able to go home, talk with other family members about it. Because sometimes when you go into the office to make that choice right there and then, it's not easy, and you have the right to be like, you know what, I would like to take this information home because I would like to do my own research on it. I want to educate myself on it. Like, I appreciate all the information, of course, the clinician gave, but I want to go home and then ask family members too, because they're going to have to be the ones that are part of your care. So, what's going to work also as a family unit, because if you have little kids trying to, take doing an infusion may not work for you if you be a single mom and you have little ones. That might not be a good decision, so taking an injection once a month might be a great medication to use. And so those are the different options. And I think that really, being able to have time to think about it as well is very important. Do not rush. Because you will be more compliant at that point. Also, advocacy, self-advocacy is huge. It's huge for me. It empowers you to have control over all your healthcare decisions. So make sure, you have appropriate treatments and support services. Maintain control over your healthcare decisions. And we've kind of went over this throughout all these slides. It's kind of like, I know we sound like maybe we're repeating ourselves, but we just want you to understand that you have the power, and this is your time to be able to ask and get the answers that you need. Because being able to take control over your health decisions will improve your overall quality of life. Because that if you've made the decision to go on a oral medication, then now you are also accountable for not taking that oral medication. Because with MS, you have to put in the work as much, like it's a 50-50. And so we can only do so much as clinicians, but we also as MS patients have to put in the work as well. And the thing is, it'll work out well in the end. Oh, I'm sorry. So with that being said, there are the key to self-advocacy for some strategies will be to educate yourself. I think we've kind of talked about that, and that's like number one. Always knowing what the different medications are, what why you want to take it, and asking the questions that you need to ask. Be an expert for your own condition. And then know the latest research too, and developments. Ask your doctor, is there anything out there that's new? Can you tell me about those new medications? Utilize resources from advocacy organizations. Track your symptoms. So we were talking about this earlier about writing things down. I love logs. And I think that people keeping a log is super great, because you may not have this symptom like every day this week, but you may have had it it's come I don't know, 6 times in the last 3 months. So, those, if you keep a log, it's so much easier when you take it with you, so you don't have to try to remember everything that has happened within this period of time. And then join education programs, conferences, like these webinars. It's super great being able to log on here and be able to ask questions or just get latest information and other people's take on, MS disease. Communicate effectively, develop skills to clearly express your needs to your healthcare providers and prepare questions. Use I statements like you know, this happened to I had this symptom. I felt heavy leg. I woke up, 3 times last night, because it's you that is experiencing it. Seek second opinions if you need to. If you're not comfortable and you're not happy with your neurologist or the team there, it's okay to go seek out other opinions from other neurologists, and know your rights. Understand the legal protections available to you, like ADA protections in the workplace. If you need modifications, don't be afraid to ask your provider to help you write out those modifications. What's going to work for you? If you work in a factory, then I can't be out in the heat, or I need to take more breaks, depending on your situation. And then reasonable, and make sure reasonable accommodations, of course, as well. And then also knowing the SSDI benefits, and how that affects your ability to work.
And then something very important is that not one doctor fits all, right? Sometimes you might not feel comfortable with your neurologist, and that's completely fine. That doesn't mean maybe that person's a bad doctor or that you are a bad patient. You just didn't click. And at that point, it might be worthy to look for another person, because it's very important for you to feel confident with the neurologist you're seeing and the whole team you're seeing, for that matter. Another important thing I would like to mention also, there's no right or wrong when coming to disease modifying therapies. It's not a recipe like this is what's going to work for everyone, or it's in this order. It's on a patient to patient basis. Important to join support groups if you can. I have had a lot of patients that are have symptoms that they're just ashamed to share, or is this only happening to me? For example, the urinary urgency, the frequency, having accidents. And it's important to join groups to have that support from other people who also are going through the same as you, to learn that you are not the only one. There are others going through it as well. Maybe seeking advice from that people, not just your professional doctors, but also other people who are going through the same things as you are, family and friends. Important to keep them around, and to share your diagnosis at the point that you feel comfortable, and also that way other people can also help you. Like we were discussing, difficulty finding words. But I tell my patients, sometimes maybe if you share with this person, look, I have MS. I'm a little bit slower with my processing speed or remembering words. Other people can also help you find the correct word, and that way you won't feel judged. But sometimes if you don't share it, that might be like a barrier. Of course, at the point wherever you feel comfortable, right? If you're having difficulty with words, I always tell my patients, try describing what you want to say so you don't get as frustrated as well. And professional, seeking help with your professional advocates, social workers. Insurance is a big thing. Trying to get your medication. Is it covered, not covered by insurance? Your appointment is covered, not covered by insurance. So that's something the social worker can help with.
And also just kind of adding to what you were saying about like I know in my journey with MS, I have lost friends, because you're always going to have people in your life too that don't understand that I have fatigue, like I cannot go out all the time, like that. I can't do those things. And if people can't understand you, then either when you educate them, if they still cannot understand, because they're learning this as well. So I always try to educate first, and I'm like, this is what I have, and and this is what it is, and either they're going to want to be on board or they're not. So don't feel bad if that's the situation too, because not everybody's ready for your diagnosis as well. I just thought I would add that on there. Also, going back to the financial insurance advocacies, knowing your health benefits, finding out, looking up your different policies, knowing your policies, especially when it comes to, the different medications. Make sure you're reviewing them annually. There are copay assistance programs with the different medications. So ask that when you're at the doctor's office, it's okay to say, okay, I'm going to start this medication. I really want to do this one based on, A, B, and C, but do they have copay assistant programs? Because, I don't want to have to come up with these big amounts of copays to have to pay. And also just the MS financial and foundations too. So the different MS, different societies like the National MS Society, they can help you find different areas where you can possibly get some financial assistance, and look up the different MS foundations that are out there, because a lot of them, or your local foundations too, because I know like our local support group here, they will help our patients that, have needs. And so ask those questions as well. And always, I had to add this in there because it's really important to always remember, right? Self-advocacy is an ongoing journey. Be patient with yourself. This is not something you woke up and it was like, I'm learning to walk, kind of thing. No, this is going to be part of your journey. It's about learning. You're going to be learning so much along the way, and you're going to have lots of questions. So be patient with yourself and celebrate small victories, even if they're like the littlest ones. Like, you know what? I did not have any like spasms this week, or I didn't have like, my legs don't feel heavy today when I woke up in the morning, or just little things like, just little accomplishments. They're big, and so always celebrate, even if it's the smallest things. It doesn't seem like a big deal to other people. It is important to celebrate. And remember that you are the most important advocate for yourself. And just know the orange awareness, the MS awareness ribbon symbolizes hope and the fight for better treatments and support.
We still have a few more slides this evening, and I was thinking that we could end on this evaluating trustworthy resources slide. I believe this was your slide, Maggie, and then the additional slides will be available in our presentation packet, and we'll also include a ton of resource links in the posting when we post the recording of this webinar tomorrow. So Maggie, if you want to do this slide, and then we'll ask a couple of questions. I know we only have a couple minutes left.
Okay. So. All right. Evaluating and finding trustworthy resources. And so like knowing and, looking it up, looking at social, we have social media, we have blogs, we have all these different things that are going to give us all this information. But know where you're looking up the sources. Make sure that they are trustworthy. Like academic and government sites are like probably the better ones to be on. So it's like .gov.edu. Those are good sites to be on. Make sure, they're evidence-based, are they backed by clinical trials? Those are important keywords you can use. And when you look up search engines too, like look up, type in the whole sentence, because we tend to just like put like MS help. That's not going to be very helpful because they're going to give you all this kind of like information all over the place. So really try to look up more educational sites. And it is important to get the best information because you can make the best decision for yourself, because you don't want to, follow like scams or, there's this breakthrough treatment. Okay, well, how breakthrough is it? Like, how much has it been researched? So those are, now you can look it up under, the different evidence-based practice or the clinical trials to see if it actually was researched.
Catherine, anything to add to this slide? And then I will ask I think probably one clear question.
I think another good thing to do if you want to like look directly into the clinical trials and that clinical part, you can also type, for example, multiple sclerosis fatigue PubMed, because PubMed is
Oh yeah.
an evidence-based. It's more for clinicians, but if you go like to the conclusions and just like a summary of that article, for example, it's based on articles. So that might be worth also searching if you
Yeah,
haven't.
that's great.
Yeah.
We'll include the link to that in tomorrow's resource when we release the recording for this webinar. I did want to note just a few different things that people have mentioned. We had someone ask about pain management, and I will just call out next Wednesday's webinar is specifically about pain. We have 3 programs in August that are about pain, a webinar, a Jumpstart program, and a YQA. So please join us for that if you are interested in learning more about pain and the healthcare professionals that you can build around that. We had some people ask about fatigue too. We did a February fatigue month this year that has some recorded and written resources in it as well. So just pointing you guys back to the Can Do MS website for some of those symptom management strategies that you guys can find. And then I wanted to throw it out to Maggie and Catherine as a final question. A lot of people are interested in like where they can find a person that specializes in MS. So, okay, I've got a PT down the street. She doesn't know about MS. So maybe where can you look to find those individuals that specialize in MS? Is that a referral you should get from your providers?
Some clinician offices are like our office. We try to send to the same people. So ask that, like, we send to the same ophthalmologist so that they're seeing trying to see all of our MS patients. And then also what I said earlier, the National Multiple Sclerosis, that site too, the NMSS, that is really good because you can type in what type of provider you need, or you can type in MS provider in your area or MS specialist. And they do, they're really good about being able to find somebody in your area.
I agree. And also telling your PCP as well. For example, when looking for a neurologist specialist in MS, the PCP should be able to also help the patients finding one.
And I know the other thing that we talked about, Catherine, was, just because you saw one neurologist, they might not always be the right fit for you. It sometimes takes some, quote, dating around to find the right provider.
And it's important for the patient to feel comfortable with their neurologist. So it's definitely worth it if you're not comfortable with your current neurologist to look around for another one.
Awesome.
I agree.
Thank you, ladies, so much for joining us this evening. I also want to take a quick moment to thank our sponsors one more time, and thank you to all of our participants that are joining. If we did not get to your question tonight, because we didn't get to a lot of questions, we had so much great content, please email us at info@cando-ms.org. I did put that in the chat as well. If we didn't get to your question, email us. You can find us on our website as well. And again, just thank you. There will be a survey that'll pop up in just a couple minutes when we end this webinar. Again,
all right, thank you.
Maggie, thank you guys.
Thank you to all of our listeners, and thank you for Can Do for having us.
Yes, thank you to everyone.
Have a great night, everyone.
You as well.
Bye-bye.